I'm Dr. Kevin Earl at Earl MD. Welcome to one of my educational videos. Today I want to talk to you about erectile dysfunction and masculine rejuvenation. I hope this video helps many men who don't feel comfortable talking to their doctors about this important area of their life. Our goal is to enrich and strengthen relationships. Erectile dysfunction and sexual problems are very common with men. In fact, it's estimated that 50% of men ages 40 to 70 experience some erectile dysfunction at one time or another. Some of the men that come to my office just want to improve the length and girth, sensitivity of their penis. Other men are middle-aged and they don't feel that the sexual part of their relationships are what they used to be. They may feel that the penis is less sensitive and that the quality of their erection and orgasm is not what it used to be. Others have significant erectile dysfunction that adversely affects their relationship. Some men may already be on Viagra, Cialis, and Levitra, and the medications are not working as well as they used to. Or they would just like to make their erections better while they're on the medication as well. Now I'd like to talk to you about the aging penis and the aging erection. There are good medical studies that show why men lose penile size and erectile function as they age. So what happens as we age that causes this problem? The two major tissues that are involved in erection are blood vessels and smooth muscle. As we age, atherosclerosis hardens and narrows the arteries to the penis, which decreases the blood flow to the penis. Risk factors for this atherosclerosis or hardening of the arteries includes hypertension, diabetes, hypercholesterolemia, smoking, age, family history of coronary artery disease. In fact, erectile dysfunction is one of the early signs of coronary artery disease. It needs to be considered by your doctor in evaluating patients at risk for coronary artery disease. As blood supply to the penis slows, and a couple of things happen. As circulation to the penis decreases, the body is not able to deliver its vital nutrients and oxygens to the penis, and tissue loss and scar tissue occurs over time. There's good studies that show evidence that if a man's erect penis is 6 inches long when he's in his 30s, it may be 5 inches long in his 60s. This results in decreasing penis size and a decreased ability to achieve as good of an erection. The collagenous tissue of the tunica albuginea is a sheath that surrounds the erectile chambers that must fill with blood in order to achieve an erection. As this sheath ages and scar tissue develops from a lack of blood supply, the hardening and stiffening sheath does not allow the erectile chambers to fill with blood, and therefore the firmness, the hardness of the erection diminishes. The smooth muscle cells of the penis are very important also. They're located in the intracavernous structures of the penis and also declines quickly with aging. Studies show that men under the age of 40 have 40% of the smooth muscle cells present. By the age of 40 to 60, only 36% of the smooth muscle cells are present. Over the age of 60, only 35% of the smooth muscle cells are present. The collagenous structure of the intracavernous structures also diminish with age. Numerous studies have shown that the penis becomes less sensitive over time. This can make it hard to achieve an erection and to have an orgasm. A little bit about Peyronie's disease. Simply put, Peyronie's disease is a condition where scar tissue forms in the penis after trauma that results in a curved penis and painful erections. The scar tissue is thought to be due to trauma, either hitting or bending the penis, and becomes a very big problem for some men. Some things that have been tried are Viagra and Levitra. These medications work by dilating blood vessels to the penis. They are very expensive, and over time these medications may not work as well. They don't do anything to improve the health of the penile tissues. They don't help revitalize tissues, nerves, and muscles. Some can't take these medications due to heart conditions while they're on nitrate medications. The Priapa shot, otherwise known as the P shot. We have found that through the administration of PRP, platelet-rich plasma, that we can rejuvenate tissues, nerves, and blood vessels. PRP is commonly used in orthopedic and plastic surgery to revitalize and regenerate tissues of the joints and face. And it's through these studies that we have applied this science to treating urinary incontinence and sexual dysfunction. In 2013, the Journal of Plastic, Reconstructive, and Aesthetic Surgery published an article of a review of multiple high-quality clinical trials. The trial showed how PRP can regenerate tissues. This systematic review describes a substantially beneficial effect of platelet-rich plasma for several indications, including a better wound healing rate, an increased survival rate of fat grafts, and enhancement of bone graft survival. The wisdom behind why such good results occur is that PRP facilitates better blood supply, tissue repair, and regrowth. That's why we have applied this science to promoting tissue, blood vessels, and nerve regeneration to the penis. The easiest way to understand PRP is by understanding what happens in our body after we have an injury. As a child, if you fall and skin your knee, your body signals cells to heal the injury. a yellow goo forms over the wound, and it gradually creates more blood vessels, nerves, and tissues, and pretty soon the wound is healed. The yellow goo is the PRP. What if we could package up this magical yellow goo and place it in other tissues of the body to regenerate tissues, nerves, and blood vessels? Well, we can. It's called the P-shot. The P-shot can be used to rejuvenate tissues, nerves, and blood vessels to the penis. When you come to the office for your P-shot, I will look over your medical history and review any medications that you're on that may be contributing to your problem. You'll also fill out a male sexual function questionnaire that will be used to measure your progress. Next, a numbing cream will be applied to your penis and a small amount of blood will be drawn from your arm. Your blood will be placed in an FDA-approved device called a Magellan. It's an autologous platelet separator system. This device isolates your platelets from your blood. This is the part of your blood that is now called the platelet-rich plasma, or PRP. This process takes about 20 minutes, and many patients like seeing their platelets separate in the Magellan. I will then activate your PRP with calcium chloride. This process releases at least 10 growth factors that are like messengers to your body to heal injured tissues. These growth factors act to increase collagen, blood flow, and nerve tissue. Next, I will transfer the activated PRP to a syringe and then inject it into the penis with a tiny needle into strategic areas of the penis that will distribute the growth factors in a proper way. The injection is painless. It typically takes about 12 weeks to see the full effect, and the results can last up to a year or longer. What is exciting to me is that men come back in and they're more confident. They say their penis is larger, straighter, and more sensitive. Their erections and orgasms are stronger. If they're using Viagra, men report that it works better. Most men experience increased girth and length of the penis, increased sensitivity, the ability to have harder erections, and better orgasms are often reported. There's no downtime, no lumps, bumps, or allergic reactions. Contact my office for a complimentary consultation, and we'll make your passions and desires for your body become a reality.